Hey guys, today we're going to practice setting up a table for a diagnostic heart cath. So the first thing we're going to do is we have our pack here, and we're going to reach our thumb underneath here, and we're going to peel this piece off. And we're going to pull our cath pack out. And then here we're just going to follow the instructions on the tab, and this is where we're going to rip it open. So I'm going to push my thumbs in here and rip these two pieces apart. And then the first thing I'm going to do is flip the back of the table away from me and the front of the table towards me. Now this is all going to be considered to be the underside of the drape, so this is why I'm allowed to touch it without having any sterile gloves on. The next thing, we'll take our 3 gowns and we'll set them aside, and we're going to open our table. So I'm going to reach underneath here, and I'm just going to pull away and down and pull it nice and taut. And then I'll come around to this side and pull again. And you'll notice that I'm not reaching over any of the sterile areas, so I'm not contaminating anything. Now everything that is off the edge of the table, like everything down here, is now considered to be dirty. So that's okay to touch. Anything that's on the top of the table is sterile, and we should not touch it without sterile gloves. Next, we're gonna open our 3 gowns. So in the packaging, I'm gonna stick my thumb right underneath the flap here and pull this first away from me, and then pull these 2 out to the side. So everything on the outside of the packaging is now considered dirty. Everything on the inside is sterile. But I'm going to gather all of this up, and then I can set this right down onto the table. And I'm going to do that for all 3 gowns. So again, thumb goes under, peel away, and then pull towards me. Gather everything up without touching the actual gown, setting it right on top. Again, I pulled it away from me, and then out to the sides. Pull this one back, just like that. Now, my friends here are going to help us start to open some of the other supplies that we need for our table. So we have our sterile gloves here. And so the best way to open anything aseptically onto our table is to hold everything on top of your arm, hold it over the table, and just peel apart so that it drops. And before we scrub in to set up the table, we're going to open everything that we can. Now at this hospital, we use reusable towels. They get sent to be sterilized between cases. So we need to open those towels. And we're going to open this package the same way that we opened the gowns. So we've got the flap here. I'm going to put my thumb underneath. And I'm going to open away, and then out to the sides, and peel this one back. And then these are double wrapped, so we're going to do the same thing. So there's another flap here. I'll stick my thumb under, and we'll peel away, and out to the sides, peel this one back. I'm going to gather everything up so that I can safely put it on the table. The next thing that we're going to open is our manifold pack. The best way to open this is to rest it right on top of your arm and pull the package back completely. And then I'm just gonna, while holding everything securely, I'm just gonna turn and dump. Just like that. What are we doing for access, Brian? I'll hold on. And the next thing that we'll open is our wire. So again, I'm just gonna peel it open just a little bit to get it started. I'm gonna hold it over the table and just peel apart so that it drops. So the next thing is I'm just gonna scrub in to set it up. So the first thing that I'm gonna need to do is to clean my hands. So I have my gel over here. Well, maybe.
That one is finicky.
Let's come out here.
Oh.
I have some more out here. So I have gel in both hands, and I'm just going to rub my hands together under my nails. And now I'm going to want to wear my sterile gown while I'm setting up this table. So the first thing I'm going to do is I'm just going to remove this piece right here. Again, I'm not touching the gown itself, so I'm not contaminating anything. And now to put the gown on, what I want to do is I want to find where the armhole is. So on this gown, we can see the armhole is right here. So I'm going to reach right inside there and grab it. And then you'll see I have another armhole right here. So I can put my fingers in there. And then all I'm going to do is let it go and extend my arms. And my arms will go right into the sleeves. So then I'm going to find, keeping my hands inside the gown, I'm going to find my gloves. And I'm doing everything with my hands still inside the sleeves. I'm going to open up the packet of gloves. And I'm going to start with putting the left glove on. So what I'm going to do is I'm going to reach inside the glove to open it up, slide my hands out just a little bit, and slide my hands right in. And then still keeping my hand inside, and pull the glove down. And to get my thumb in, I just pull the thumb, and then I can pull the sleeves back and it'll pull the glove on nice and tight. Now for the next hand, this hand is sterile, so I can touch. I'm gonna reach my hands, my fingers underneath the flap to hold the glove open. I'm gonna inch my fingers out just a little bit. And slide the glove on. Now I can adjust the sleeve as necessary. The first thing I'm going to start with is getting the gown and gloves for the procedure ready. So we start with the physician's gown and gloves first, and that's going to go on the bottom. So this doctor wears a size 7.5. So we'll lay his gloves out and then his gown on top of that. And then we'll lay the scrub tech's gown and gloves on top of that. So we'll lay down another pair of gloves and then her gown. Now the next thing we want to be able to do is have a nice clean surface with towels, which is going to help us keep our table dry during the procedure. I'm just going to move this out of the way, push everything to the top, and I'll grab my towels and just lay one single layer across the length of my table. Another advantage to having these towels is that during the procedure you have a place to hide supplies that you want to keep safe without falling off the table, but you don't want them getting in the way of everything else. So now that I have these all laid out, I can start laying everything else out that we need. So we'll first start with our bowl, and this is where our saline is gonna go. So I'm gonna lay it out. And then before anybody can put any saline in there, I need to label it. We need to always label all of our syringes and bowls and cups with what is going in them. So I'll lay the decanter out for someone to grab. And I'm gonna stick a sticker of Pepper-Nice saline right on our bowl, and I'm just gonna lay it right inside. Watch it there. Perfect.
Gentlemen, can you go a little slower so he can film it?
He's listening.
Oh.
I'm listening.
Yeah. So he's being very careful not to have that decanter touch anything on the sterile field because he doesn't know if he contaminated or not. So this way everything stays nice and clean. So perfect. Now this is full of Pepper-Nice saline. The next thing that we're gonna do, dump all of this stuff out. We also want to label our cups that we're gonna need for any of our medications. So one medication for sure that we're gonna need is lidocaine. So I have my 2% lidocaine sticker, and it's gonna go right on the cup. And I'll lay it facing out so that who's ever giving me my medications can see clearly. Perfect.
Very nice.
Take one for nitro, one for your radioplasty.
All right, so then I will also have a cup labeled for nitroglycerin. So I have my nitroglycerin sticker, and we'll lay that out. And then I'm also going to have a cup that can have our radial cocktail in it, which is going to be a combination of heparin and nitro. So I will label those, and verapamil, so I will label those as well. I put all 3 stickers on here. I'm gonna go ahead and set my drape up in the far corner because we won't need that until it's time to drape the patient. And then we have our package of 4x4s here. I'm gonna pull those out of the bag. And I'm gonna stick about half in this bowl and the other half we're gonna keep out. So we can keep these nice and dry. And then with this saline, I'm just gonna dump some right into this bowl. This way we have access to some wet 4x4s that we can use throughout the procedure to keep all of our equipment clean. So it's nice and saturated. And then we need to label all of our syringes. And first we're gonna start with our Pepper-Nice saline. I'm gonna lay my stickers right around the top. And these are all gonna be 10 cc syringes. And I'm gonna label as many syringes as I can, because you can never have too many. The next syringe we're gonna label is gonna be our lidocaine syringe. So I still have one more 2% lidocaine. And then usually what I like to do with any medication to identify it as a medication as opposed to saline, I'm gonna put the sticker on in the opposite direction so that everybody can clearly read it. And then I'm gonna draw up my lidocaine here. I'll draw up a full syringe. And I have my 25 gauge needle that I'll twist right on, and I'm gonna set it right here because this is where the doctor is gonna look for it. The next thing that I'm gonna label is a nitroglycerin syringe. And with nitroglycerin, we wanna be able to use a small syringe. So I have a 3 cc syringe here, and I'll just put the label on this way. And I'm just gonna put that right into our cup here. And then finally, the syringe that's gonna be used to give the radial cocktail. For this doctor, he likes to give it in a 20 cc syringe, so I'm gonna stick it on the same way. This is just a blank medication sticker. This wire, we always like to keep it wet if we can, so I'm just gonna put this right into our saline bowl so that it could sit in the saline. And then the remainder of these things, this is our sharps box, so I'm just gonna open this up and expose the adhesive on the back side. Stick it right in there and gather any of my other sharps that I have in my pack and put them all in here so they can all be contained to the same place. Your pack may come with clips. This one does. I usually like to just stick them right on the bowl so that I always know where they are and they're easily accessible. And then any remainder supplies, our pack comes with some scissors and Kelly clamps. I'm gonna set those up to the top so I can access them if needed, but they're out of the way during the procedure. And then this pack comes with a lot of extra syringes, which we don't need, so I'm just gonna set them aside for now so I can grab them if I need them. And then we have a tegader, which I like to keep dry if at all possible, and the best way to do that is to just stick it right underneath the towel. But as long as you know where it is, you can put it under the towel. My final step is I'm gonna set up our manifold. So I'm gonna grab all of that. So some of the things come disassembled on it, so we just need to assemble it. So we're gonna take our control syringe and put it right on the end. And you'll know which end to put it on because it can only connect one way. This is a male lure lock and this is a female port. So it's gonna connect here. This is a male lure lock as well, so we can't put those two together. So it's just gonna twist right on. And then I'm gonna find my line for contrast, and that's just gonna connect right on the top port up here. Now because we only have 3 lines but 4 ports, there is gonna be one open port. So for our example today, we're just gonna move everything up 1 port. So I'm just disconnecting and twisting on. And then moving this one up as well. So our open port will be the one on the distal side. And then we also need to connect our transducer to our pressure line. And this one as well, it can only connect one way. So we have our male end here and our female end here. And the two are just gonna twist together. And then we have some extension tubing. This just allows the doctor to stand a little farther away from the patient to reduce their radiation exposure. And this is just gonna connect right on the end. Again, we have the male end and the female end, and the two are just gonna go together, just like that. And then I just like to have everything wrapped up nice and neatly so that when it comes time to drape the patient and set up, I can grab everything in one handful. And then sometimes your manifold may come with some of these caps. You can put them wherever you like. I like to just put them right in our bag of saline. These two things here are going to be sterile covers. So the first one, this is our dome cover. This is what's going to be used during the procedure and placed over the II. So it's going to allow the doctor during the procedure to be able to touch the buttons on the side and remain sterile. The next one is the shield cover, and this is going to go on our x-ray shield right there, which during the procedure is going to get moved right up here. And with it being covered, it allows the doctor to move the shield around while still remaining sterile. And then the last and final step that I like to do, but is not necessary, is I like to take a couple towels and unfold them and just have a little pile, because once it comes time to draping the patient, once the drape is on, I like to put a couple towels because it just helps keep everything extra clean. So this is just gonna save time once it comes time to set the patient up. And if you ever have any equipment that's coming from sterile processing, so it needed to be re-sterilized, there's gonna be an indicator with the equipment that indicates whether or not it was properly sterilized. So because these towels came from sterile processing, there's gonna be a tab like this that's tucked into the towels, and it's gonna tell you whether or not they were sterilized. So for this, because the full line is black, it made it all the way to accept, which means that they're appropriate and we know that they're properly sterilized. Do we know our access yet? Okay. Push up my glasses. Now that we know what our intended access is for the procedure, Heather's gonna open my sheath for me. Thank you. And we're gonna go ahead and flush it and make sure that it's all prepped for the procedure. So I'm gonna take one of my syringes for saline and fill it up. And I'm just gonna give it a flush. So I'm gonna hook up to the end of my stopcock here. We'll take this cap off. And I wanna flush everything. So I wanna flush out this port that way. And then in order to flush down the line, I need to turn this stopcock this way. So I'm gonna flush the line. It's gonna connect the sheath, and our saline's gonna come out this way. And now we know we're fully flushed. And then because I wanna close it to make sure that the patient doesn't bleed out of it later once we put it in, I'm gonna turn our stopcock to close it. Then I wanna flush the dilator. So our dilator is right here. Just gonna stick the syringe on and flush. Only takes about half cc or so. And then I'm gonna take our dilator and stick it right through the valve on the sheath. And I'm gonna advance it all the way until you hear a click. And now that's ready to go. Almost all sheaths will come with the wire necessary. So because this procedure we're going radial, it's gonna come with a very small wire, which is found in this hoop. So you just pull these two pieces apart, and the wire is sticking out right there. Now you can either pull the wire out completely or just leave it in the hoop for this part. I like to just leave it in the hoop. And then this sheath comes with the wire needed for access.
Needle.
Thank you, needle. And it looks just like that. We wanna keep it covered though for safety. You don't wanna accidentally poke yourself. So we're just gonna keep it covered, and I like to give that a little flush as well. So then, everything that we need for the first step of access, which is the lidocaine, the needle, the wire, and the sheath, I have all laying right here because this is right where the doctor is gonna stand when he gets access. And then I like to have all of my syringes filled and prepared. So I'm just drawing everything up. And when you're drawing up your syringes, you wanna make sure that you have no air. So you always wanna give it a little tap and push out to make all the air go to the top, and then just push out the air. Just little drips. Just like that. So that one had a little bit of air in it, so I'm just gonna give it a tap and push it all out. And usually I find the best way to draw up saline without getting any air in it is I'll draw a little bit up, usually about a cc or two, and then I'm gonna push it all the way back in, and then draw up a full syringe. And you should have no bubbles. Just like that. And then my radial cocktail is already in the cup. So I'm just gonna draw all of that up into this syringe as much as I can. And now I have air in there. Just gonna give it a tap, get rid of all those bubbles. Push all the air out and set it right over here because the doctor is gonna need that for access. And I'm gonna position it label facing up so that the doctor can clearly see what it is. And I did the same with my lidocaine. And that's how you set up a table.